All right, welcome back to the Elias Smacko Show. Just one thing I want to get to here before we get to our next guest. Immigration and Secularism Minister Jean-François Roberge was speaking during this hour just a few moments ago, and he's announced the creation of a committee to enforce secularism around Quebec, particularly in schools. There will be a committee headed up by a pair of lawyers. They're expected to produce a report by August with recommendations for the government on how to strengthen Quebec secularism laws. And get a load of this, the committee also been charged into looking into what the government describes as religious infiltration in schools. They will also open a confidential line for people to report information about that what they call religious infiltration into schools. Apparently, also going to be looking at non-provincial institutions, municipal institutions, and public spaces. Okay, so that's coming out from the Immigration and Secularism Minister earlier this hour. We will be keeping track of that story, I imagine, throughout the week. Okay, let's turn our attention now to abuse cases in long-term care. A new report from Quebec's Ministry of Health reveals a troubling rise in incidents and accidents in healthcare and social services, particularly those affecting seniors. 2023-2024 period, nearly 56,000 incidents were recorded, marking a 13% increase from the previous year. Concerning trend, the rise in abuse cases, especially in long-term care facilities. Seniors aged 75 and older being the most affected. We go now to Liberal MNA Linda Caron, represents the riding of La Pinière, and official opposition critic for seniors. Madame Caron, welcome to the program.
Thank you very much. Good morning, Elias.
How concerned are you by this latest report?
I am very, very alarmed by this report, especially that the 75 plus who are in long-term facility are the ones who are most targeted by cases of abuse, aggression, intimidation, bullying, harassment. And it makes no sense to me because 75-year-olds and plus who live in long-term care facility are people who are vulnerable, they're fragile, they're delicate. You need to take good care of them. And I understand that it's difficult work. So I know that most of our healthcare professionals do the utmost. They take care of them, but obviously some do not, or are not working in the right conditions to look after these people properly, because it's over 9,000 people who have suffered such cases. Some of them did not have bad consequences, but some of them did, including 13 cases where the abuse contributed to their death, and that's totally unacceptable. So I find this very, very alarming and dehumanizing also for these people who are, that we need to look after. They've built Quebec, they've raised us, they taught us, they helped us along the way, and now it's our turn to give back to them and look after them properly. So I'm very disconcerted by this.
Is this coming down to bad employees? And are we talking about a few bad apples? Or is there some sort of systemic problem in this province that leads to abuse becoming the norm?
Well, the report does not say if this is the feat of a few bad apples, as you said, or if it is spreading. It does not say that. But the fact that the numbers are so high and that they've increased from the previous year, we have to remember also, to put this in context, that it's been 3 or 4 years now that people who see things happening need, maltreatance against seniors who see that happening, they have to report it. So perhaps it happened before. I don't know if it happened in the same proportion before or not, but now for the past 3 or 4 years, the number of reporting has increased because it's compulsory. But the law now allows investigations to be made and sanctions to be applied. The problem is, since that law has been has been strengthened in 2022, I have not seen any sanctions applied to people who were, any penalties, even financial penalties, and this is the law. So what we need to do, I believe, is now that, the reporting is being done, well, we should enforce the law, and that's what I'm asking the Quebec government to do. Enforce your own law to make sure that people who are not perhaps in their place taking care of seniors, are made to leave, and that perhaps we train better the people who are taking care of our seniors. Also, to make sure that working conditions are fine, because I said earlier, it is difficult work to do, but if you don't have enough staff on a unit to look after everyone properly, it's possible that, people have less patience because they're more tired and all of that. So that's something that the government has to work on and make sure that there is sufficient personnel and that the personnel is well trained to look after the needs of seniors and to understand that seniors are, perhaps they can't hear when you give them an instruction or when you ask them for something. Perhaps they have cognitive problems that prevent them from speaking and being clear about what they need or what they like or how they don't like to be handled. So people have to be trained properly. They have to have proper working conditions. And if that doesn't work, well, you need to enforce the law and apply the sanctions.
But Madame Caron, I guess based on what you're telling me, it almost sounds like we have such a shortage of staffing. We don't have enough people as is. That one of the reasons we may be turning a blind eye because there's no other choice, right? It's bad staff or no staff. Do you feel that could be part of what's at play here?
Well, it's in the realm of possibility, but I think that we need we can't just accept that. We have to find a way to have enough staff and staff that is properly trained to look after people, because I certainly wouldn't want my mother to be in a long-term care facility knowing that perhaps she's being bullied or sexually abused because there's no other staff to do it. That's not acceptable.
What's your message to our listeners who are listening to us talk and now they're really concerned about their loved ones that are in long-term care facilities?
Well, I think that they, as much as possible, they should be there and be on the lookout. Be sure that their parents have the care that they need, and if they see something that's not that raises an alarm, they should inquire more and talk about people there and advocate for their parents who are in long-term care facilities. Yeah. Again, as I said, there's excellent facilities, excellent professionals who work with them, but as the report shows, there are quite a number of places where things don't go properly, and we have to, we have a responsibility also to look after our parents who are in long-term facility and advocate for them.
Madame Caron, we're going to have to leave it there. Thanks so much for joining us.
My pleasure.
Linda Caron is the M&A representing La Pinière and the Liberals' opposition critic for seniors.